Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.
And I'm Fred Goldstein with Accountable Health and working with Nick and others to help employers consider how to reopen, operate, and particularly look at their broader health improvement programs post-pandemic or wherever we are in the pandemic right now. So, Nick, lots of vaccine news, vaccines going out now. We're starting to get shots into people's arms, but there's all kinds of unique things happening, some of them perhaps not so good.
Yeah, so vaccine shopping. Yep, I'll pause for a second. Wait, what did he say? You probably have to be like me and look that up and say, how are people shopping for vaccines? So there's a number of things going on here. First of all, we've got this piecemeal patchwork craziness throughout the US, which is not just 51 different countries, it's, thousands of different counties and, all sorts of implementations. You've talked about this a few times with Evite and who knows for scheduling, all sorts of problems. So people are challenged and recognize that. But for those folks that are able to get to it, that maybe are able to hit the refresh key, they're booking appointments, but then they're not satisfied with that, and they're going and booking multiple appointments. How do they do this? Well, they just find another site that's nearby, they book an appointment. And why are they doing this? Because they're worried they might get canceled, or worse yet, they're saying, no, I want this vaccine over that vaccine. Well, my problem with that, and I got to be honest, I've done something similar in the supermarket. I get my wife to stand in one line and I stand in another just in case one of them goes further. But here's the difference, folks. When we decide to enter a single line, that space opens up and somebody can use it. What's happening is these vaccines are not getting used because they have no shows and they've got nobody to fill those spaces. That's not okay.
So you've actually got people multiple booking and then not showing up. And then obviously, if there's nobody there to take the vaccine, those get wasted.
Well, wasted, worst case, or put back in the freezer, especially with the vaccines that we're predominantly using in this country that have all the cold storage and they have a limited life expectancy outside of that temperature, the super cold when they're reconstituted. So, waste is an awful thing when you've got all these people. So absolutely inexcusable. So I wouldn't advocate it. Book your appointment and accept that, yes, you might get canceled, but I think we're getting better. And you've got some news on that, right?
Yeah, well, it's interesting too when you think about that because I've been talking to some people out there about getting their vaccines, and they're not in the groups, the 1A or 1Bs, and I know we're beginning to move into maybe the Cs, et cetera. They're not in those groups in certain states, and so they've actually been hanging out or going to the vaccination sites late in the afternoon and just waiting to see if something opens up because of a situation you're talking about to try and get some, or maybe there's some extra vaccine or people didn't show. So it's an interesting approach. And then you're also seeing and hearing wealthy people buying their way in, which also is just a disgrace. And we still have issues around how do we schedule this? Who's scheduling this? I know, Nick, you brought up earlier a really unique idea that came out about scheduling that somebody's done. So people are taking some of this and running with it and actually doing some cool stuff.
Yeah, so big shout out to Olivia Adams. She's on maternity leave, for crying out loud. She's a programmer, and she looked at the state of Massachusetts and said, we have this piecemeal patchwork. Nobody knows where the appointments are. And she created, for want of a term, a screen scraping program that went out, does it every 5 minutes, and produces a centralized register of those appointments where the availability, wait time, well, not wait times, but, for booking the appointments, and then links directly to it. What a brilliant innovation to the patchwork of challenges that we have. We don't need that just for Massachusetts. We need that on GitHub. And her problem, she's hosting this herself. She's begging for money so that she can actually pay for the hosting. Because guess what? Everybody's going, well, that's brilliant. I'm going there instead of going to all these different places. We have got to roll this out and do this professionally. We've got to do a better job.
Yeah, and definitely kudos to her for setting that up. What a brilliant idea. And to show that, hey, this can be done. It's not, in the end of the day, rocket science. And that, brings up another point. And I'm beginning to hear this now because the vaccine's getting out there, actually from some professionals and others. I've been vaccinated. We've been vaccinated. We don't need to worry about stuff anymore. We can go ahead and eat together and sit in small rooms and this and that. But the reality is, we can't, can we, Nick?
Survey says no. And, there's a multitude of reasons, but let's hit off on a few of them. First of all, even with the fantastic vaccinations, there is still a subset of people that will get the disease, that 5% in the 95% coverage. So you could still get it. Also, there's all these other people around that don't have it. So, you potentially spread it. And then we still don't know if you get exposed to it, you've had the vaccination, do you get the disease but don't have any symptoms and essentially suppress it? But more importantly, are you able to spread it? We can't answer that with certainty. And until we've essentially suppressed this virus, things do not return to the way that they were or anything close to that. And we have to use the NPIs, the non-pharmaceutical interventions, which are, Fred?
Wear a mask, social distance, and keep washing your hands and use proper hygiene. And for me, it's become 2 masks as I'm reading more about it and really trying to, if I have to go indoors, it's as fast as I can do it going through that store. And I am walking around this way and that way to try not to spend too much time because the new data is showing from the NFL, as we've talked about and others, that it can be spread in a shorter period of time, and clearly with the newer variants that are more transmissible, the issues are much higher. So once again, Nick, another fantastic week. Really appreciate it. This is Fred Goldstein with Accountable Health. If you have any questions about your company, how you're operating, or even looking at your broader health improvement programs, consider the mental health issues we're now seeing. Consider the anxiety and stress, the work from home issues. What about all the screenings that potentially people have missed over the past year? All of those are going to impact your health programs. So take a look at our website. Give us a call. We'd be happy to help you.
This is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.